This slide I will explain more about viral hepatitis and type of the hepatitis. Viral hepatitis is a systematic viral infection in which the necrosis and inflammation of the liver cell produce a characteristic cluster of a clinical, biochemical, and cellular changes. So today there are 5 types of the viral hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. It's very important by the end of this lecture to know that hepatitis A and E is transmitted through the fecal oral route. However, hepatitis B, C, and D it is transmitted through the blood and sexual contact. I will explain each type of the hepatitis here. So I will start with the hepatitis A. This form of hepatitis is transmitted primarily through the fecal oral route and by the ingestion of the food or liquid infected by the virus. So as I explained, it's very important to know that this type of the virus is transmitted through the food, contaminated water or contaminated food. So it's more prevalent in the country with the overcrowding and poor sanitation. So it's very important to maintain to prevent hepatitis A. It's very important to maintain hand washing. When symptoms appear, they mostly like flu, upper respiratory tract infection with the low-grade fever, and how it's also very important to understand that early signs and symptoms of hepatitis A include anorexia, and so the patient will will refuse eating or will lose of the appetite, and nausea and vomiting, and also weakness. So hepatitis A virus, it's anorexia and early symptoms, and it's very important to know that this is the first sign and symptoms of the hepatitis A. And hepatitis A vaccine is recommended for people traveling to the location where the sanitation and hygiene are unsatisfactory. So it's very important to understand that hepatitis A is transmitted through the fecal oral route and through the contaminated water and contaminated food, not transmitted through the sexual contact or blood. Nurses should encourage proper community and home sanitation, and nurses should encourage also individual hygiene. So this is about the hepatitis A. Regarding the hepatitis B, it is, as I explained, it is transmitted primarily through blood and sexual contact, so can be found in the blood, saliva, semen, and vaginal secretion, and can be transmitted through the mucous membrane and breaks in the skin. So fever and respiratory symptoms are rare, and also, but however, the patient will have may have loss of appetite, abdominal pain, generalized itching, malaise, and weakness. And it's very important to understand the hepatitis B is transmitted through blood and sexual contact. So patient with hepatitis B may develop jaundice and or may not evident, but if jaundice occurs, the light-colored stool and dark urine accompany it. And liver may be tender and enlarged, and it's very important to understand for active immunization is recommended for people at risk for developing hepatitis, especially healthcare provider and hemodialysis patients. So it's very important to understand that one of the measurements to prevent getting hepatitis B virus, it is getting immunization, especially for healthcare provider and patient with hemodialysis, because normally patient with hemodialysis receiving dialysis and at risk to develop hepatitis B. And but however, maintaining precautions, standard precaution at the hospital, it's very important. Plus with the immunization, but standard precaution is the first priority. Hepatitis B, immunoglobulin may provide passive immunity to the patient to the hepatitis B, and is indicated for the people exposed to the hepatitis B virus and have never received hepatitis B vaccine. And provision for adequate rest and nutrition must be ensured. So patient may need rest and need nutritional support when he get hepatitis B virus. So it's very important to understand that with hepatitis B virus, to to maintain standard precaution, and also to prevent the standard precaution by preventing any secretion from the patient, and also to get immunization if you are at risk of developing getting hepatitis B, especially healthcare provider. Another type of hepatitis is hepatitis C virus, and hepatitis B virus, as I explained before, it is transmitted through the blood transfusion, and through blood, and also through sexual contact. And people who are particular at risk of hepatitis C include IV injection drug user, patient receiving frequent transfusion, those who require large volume of the blood, and healthcare a provider. So it's very important to know that the transmission of the hepatitis C and hepatitis B are similar. So and also the precaution are similar. So the clinical course of the acute hepatitis C is similar to that of the hepatitis B, and infection with the hepatitis C increase the risk of person developing hepatic liver cancer. So it's very important to understand there is no vaccine for hepatitis C, and a patient who develop hepatitis C is more risk to develop cancer and develop liver cirrhosis than other type of the hepatitis. And other type, which is hepatitis D. Hepatitis D also, you have to understand, it is transmitted also through the blood, and also but however the patient will not get hepatitis D unless he have hepatitis B, because hepatitis D require hepatitis B surface antigen for its replication, and only people with hepatitis B are at risk of developing hepatitis D. So patient, if he has hepatitis B, may at risk to develop hepatitis D. The symptoms of hepatitis D are similar to those of the hepatitis B, but however, you should know that patient, if he developed hepatitis D, are more born to develop hepatitis, active hepatitis, and liver cirrhosis. Normally, patient with hepatitis B will not have any symptoms, but patient with hepatitis C and hepatitis D, they have more symptoms. And other type of hepatitis is hepatitis E. And hepatitis E, as I explained before, it is transmitted through the fecal oral route. And in this hepatitis, it is because of the contaminated food or contaminated water, and it is poor sanitation. It's so because of that, it's very important, to maintain, good, oral hygiene, and maintain, hand washing, and to prevent these type of hepatitis. And it has similar symptoms to the hepatitis A, and patient may develop also jaundice with hepatitis A. And also, it's very important, as I explained, avoiding contact with the with the virus through the good hygiene, including hand washing, is the major method of the preventing hepatitis E and preventing hepatitis A also. So it's that what you have to understand about it, and thank you for attending this lecture.